Calling the 1 p.m. HHS agenda, which includes the 1 p.m. HHS deferred measures agenda for DM. Present with me today is my Vice Chair, Senator Aquino, and Senator Awa. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business 1 p.m. Friday, February 9th, conference room 225 and via video conference. Your audio will be muted and video disabled until shortly before it's your turn to testify. Each testifier will have 1 minute to testify. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I'll be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed caption does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislature's website. You will find a link on the status page for the measure. We appreciate your understanding and remind you that the committee does have your testimony. They review them, so I encourage you to use your time to either add additional comments or you can stand on your written testimony. First up today will be to do the decision-making on the Monday calendar, which is, and also present is Senator Shimabukuro. First up, for SB 3114 relating to the Child Abuse and Neglect Central Registry, Chair's recommendation is to pass with tech amendments. We're going to add a December 31, 2050 effective date to promote further discussions on how to make the notice requirement of being inserted into the registry clearer to those who are being affected. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, Chair votes aye. Vice Chair votes aye. Senator Keokalole
No.
is excused. Senator Shimabukuro.
Aye.
Senator Awa.
Aye.
Recommendation is adopted.
Thank you very much. For SB 3115 relating to relative resource caregivers, Chair's recommendation is to pass this with tech amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Chair
Okay.
votes aye.
Okay, thank you very much. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
For SB 3116, Chair's recommendation is to pass with tech amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Chair votes aye.
Okay, just for edifications, we're on Senate Bill 3116,
Yes.
SD1. Okay, 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
For SB 2483 relating to community health workers, Chair's recommendation is to pass with the Office of Foreign Affairs proposed amendments. And we're going to note to advocates that right now there is no monetary amount to insert in the blank appropriation. So as it stands, even though we like the intent of the bill, this bill cannot pass with a blank appropriation. So I urge advocates to figure out what amounts to put in as this goes through the legislative process. So as for this committee, it's to pass with the OHA proposed amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, thank you very much. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 3100, Chair's recommendation is to pass with the University of Hawaii's proposed amendments and tech amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Chair votes aye.
Okay, thank you very much, Chair. 4 members are present. Any reservations? Any noes? Recommendation is adopted.
For SB 2797 relating to water catchment. Oh, I'm sorry. No, I did mention that one. That was SB. We did SB 2483, right?
Yes, we did.
Yeah, we did. So for SB 2797 relating to water catchment, Chair's recommendation is to pass with amendments. We're going to add a section F that there shall be a limit of 1 tax credit per each water catchment system installed within a 5-year period. We're going to add a defective date for this to ensure further discussion. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye. SB 2797.
Okay, thank you very much, Chair. 4 members are present. Any reservations, any noes? Recommendation is adopted.
So for SB 2186 relating to healthcare workers, Chair's recommendation is to pass with amendments. We're gonna add after healthcare facility, the phrase healthcare facility to include home of another, including foster care homes and tech amendments. And we're also gonna add in a effective date of December 31, 2050 to ensure further discussion. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, 4 members are present. Any reservations, any noes? Recommendation is adopted, Chair.
So for SB 2460, Chair's recommendation is to pass this as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, thank you very much, Chair. Passing unamended. Any reservations, any noes? Recommendation is adopted, Chair.
Okay, for SB 2492 relating to nurse licensure compact, Chair's recommendation is to pass with amendments. We're gonna replace the word Washington with the word Hawaii on line 12, page 43, and pass with tech amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, thank you very much. Any reservations, any noes? Recommendation is adopted, Chair.
Okay, thank you. We are gonna recess pending the arrival of CPN. Recalling the Committee on Health and Human Services, the joint hearing with Committee on Commerce and Consumer Protection. Present with me is Vice Chair Senator Aquino and Vice Chair of CPN Senator Fukunaga. First up, we have SB 2123 relating to health. We have Dr. Lewin, come on up, for a State Health Planning and Development Agency in opposition.
Aloha. Thank you, Chairperson San Buenaventura, Vice Chairs Aquino and Fukunaga. Thank you for the opportunity to testify. Well, I think as you could guess, as the Administrator of SHPTA, we're opposed to this bill. 35 states in the District of Columbia still have a CON process, even after the federal government, which originally funded all states for this, discontinued the funding. So states picked it up because they believed it had value. But it's done right. It's based on medical science. It's based on really good utilization data and on public comment and public opinion. So our testimony includes that. There's a bunch of plus and minuses. There's a lot of supportive data of the value of CON. There's obviously some free market folks who don't like anything like this, but we tried to include that in our testimony for you to show you that there's an overwhelming positive bit of testimony. States do this differently. Some do better than others. And I want to just let you know that we do a great job here. It's a small team of people, actually only 3 FTEs, manage the whole thing for the state. We get most of the filing time is around two weeks.
So Dr. Lewin.
Okay.
Thank you. Yes.
Okay.
So
good.
I'm limited, for those who haven't been to my hearings, I
1 minute.
usually-
Okay. All right.
So what, because I do my homework, I do actually
Thank you.
read all the written
And I think you can
testimony.
see it. We strongly oppose it.
Thank you
so
very
much.
much.
Okay.
Okay, next up, we had Ted Kepalas, the Grassroots Institute of Hawaii and support. Okay, next we have Benjamin Sadowski, the Night Here Local 5, providing comments. Next, we have US Renal Care providing comments. Next, we have Dr. Abe, Hawaii Primary Care Association in opposition.
Hi, Eric Abe, Hawaii Primary Care Association. Unfortunately, I'm not a doctor.
Oh, sorry.
But you have our testimony. We respectfully oppose this measure. I guess to summarize, we asked this committee and the legislature to give the governor and Dr. Lewin a chance. Thank you.
Okay, thank you very much. Next, I see Paige Choi, Hawaii Healthcare Association of Hawaii in opposition.
Thank you. Thank you, Chair and committee members, so much for the opportunity to comment. So sorry, I'm still recovering from my illness last week. So we do oppose this measure. I really do want to call out what Dr. Lewin talked about in his testimony. We are the regulated industries that have to go through the certificate of need process. Our members who do come back to us with feedback, if they do not feel a regulatory process is going well, have not come to us with any issues with the certificate of need process. It works efficiently, it works effectively, and we believe it's necessary to protect patients and keep costs down. When we talk to our counterparts in other states, those who have gotten rid of the certificate of need process, what you're seeing is the degradation of a lot of community-based providers, because you do have folks who tend to be more profit motivated come in and they'll cherry pick patients. So we do really think that maintaining this process is in the best interest of the state. So thank you.
Okay, thank you very much. Next, we have Tricia Yamashita, Kauai Hospice, Inc. in opposition. Next, we have Michael Robinson, Hawaii Pacific Health in opposition. Next, we have Kokua Mao in opposition. Next, we have Jamie Detweiler, Hawaii Federation of Republican Women in opposition. Next, we have Brenda Ho, Hawaii Care Choices in opposition. Next, we have Ellen Godby Carson in support. And we have, I see Michael Robinson on Zoom. Please proceed.
Good afternoon, Chair. You have my testimony in writing. I just wanted to add that Hawaii has the 48th lowest per capita spend per enrollee in the nation. It's got the 49th lowest per capita spend in Medicaid in the nation, according to CMS. And those low spends, a lot of it are attributable to infrastructure like SHPTA that ensures that there isn't duplication of services across our state. So I just wanted to add that to the testimony, and I'll stand on my written testimony. Thank you.
Okay, next we have Michael Dewitt in opposition. Anybody else wishing to testify? And three other individuals, Hope Young in opposition, Marilyn Matsunaga in opposition, Daniel Fishberg in opposition. Anybody else wishing to testify on SB 2123? Okay, seeing none. Members, any questions? Seeing none. I have a question. Paige, could you come on up? So it seems to me you folks are representing those who are already practicing in the state.
Yeah.
So it's like in their, let's face it, it's in their best interest to prevent competition, right?
Yeah, I think that is one of the concerns that folks have with the Certificate of Need program. I will say that I've witnessed several CON applications come through. I have not generally seen that if a competitor comes in and there is a need and there is the workforce to be able to serve that population, that you have organizations saying no, right? I do think that we have a very collaborative environment where if a need is there and it meets those requirements, you don't have our organizations coming out opposing those institutions.
So the reason I brought this up was because my community is in dire need.
Yeah.
And there was a certificate of need denial, okay, for a dialysis treatment center that ended up moving over to Hilo. So my community still does not have a dialysis center, and my community then needs to drive over an hour. And you know, with dialysis, it takes about 2 hours or so.
Yeah,
For
absolutely.
their service. So in psychiatric services, I see that in your testimony, seems to me you also know that there's a huge need for psychiatric services, and you are willing to at least concede the fact that in those areas of dialysis and psychiatric services, there is far more need than there is supply. And I see certificate of needs as being really it's state sanctioned antitrust.
Yeah, I think if I may, and I don't want to speak on behalf of Daryl and Dr. Lewin, there was a bill heard earlier today on the House side, HB 1963, that would provide some exemptions for the psychiatric services for dialysis. We are supportive of those changes. I do think that a conversation about removing some services from the certificate of need requirement is warranted. And I think those two services in particular are ones that I know our members are supportive of.
And frankly, also, seems to me there's more and more consolidation of services. Like in my community, it seems that the big people, and in which case it's HHS, starting to hire more people, are squeezing out, like Pacific Surgical, so associates who've been there before.
Yeah.
And because the certificate of need, they're unable to partner with others to be able to remain. Okay. Any other questions? Seeing none, I mean, Dr. Lewin, could you come on in? So frankly, with the bills that we had previously heard in this committee, at least HHS committee, we are making your office far more robust than just applying or disqualifying certificate of need applications. Will you be able, with this robust planning and jobs that we are handing your agency, will you be able to timely go through certificates of need?
The answer is yes, because we have 3 people dedicated to that purpose, a legal person, a data analyst person, statistician, and a community group. And we have advisory committees from all regions of the state that come in and apply. So yes, we can. We're going to be adding new staff to do the new functions.
Okay, so one other thing, do you oppose, you're supposed to help out rural communities, right? That's part of SHPTA.
So absolutely.
But why do we even need to have a certificate of need in areas like rural communities where we actually have healthcare deserts?
The answer is very simple. We want quality services wherever they are. We have, people, the DOJ is closing down hospices all across the western states that were for-profit, doing terrible services. And there occasionally can be poor quality services in any area. Our goal really is to make sure that the agency that applies is a quality agency, has a quality history, and that the community, we're not there to support, we know we need more hospice service, more psychiatric services desperately. And we'll do everything we can to expedite that stuff to make it happen.
But even with the certificate of need, you folks are closing up hospice centers in the state of Hawaii anyway. I mean, like the more recent hospice center over in Hilo is being closed down because now they're pushing for in-home hospice. So your argument regarding for-profit or not-for-profit, if you folks are closing up hospice centers anyway, it seems to me by removing the barrier of certificate of need, we actually attract more services.
Well, we aren't closing hospice services. That's happening on its own. It has nothing to do with us.
Yeah.
And in fact, we have a certificate of need approved for a hospital on West Maui, but nobody's coming up with the money. So we will be there to expedite services where there really is a lack. And we want to see the best healthcare in anywhere in the country here in Hawaii. That's what we're about.
Okay, thank you very much.
Thank you.
Any other questions?
Yeah, I'd like to follow up. If you could stay right there.
Oh, sure.
I can understand what you're saying, but the comments of the health chair really resonate. Because what you're saying in your testimony, what you're saying here at the table is not actually the outcome that's being experienced in many different sectors of the community. And I can tell, I want everybody, I want this to be on the record in the YouTube. The dialogue over dialysis access and how it relates to the CON process has been one of the most distasteful conversations that I've ever had as a part of my time in the legislature. It is really problematic. really problematic. And it's not just for rural communities. I mean, on Oahu, there isn't sufficient access. Because of the landslide on Pali Highway a couple of years ago, we had dialysis patients who were missing their appointments in town because they had to drive around due to emergency. In the same year where dialysis facilities were fighting with each other in this legislature about CON. So I want to know exactly how you intend to clean up all of those shenanigans while also maintaining your appropriate regime if this bill doesn't pass and reversing the healthcare deserts in those rural areas. You can't require quality of entities that don't exist.
I totally empathize with your comments about the deserts of services. We need to deal with that as a state. I'm totally there with you. And I think as an agency, we're there with you on that. Oftentimes, there's nobody putting the funding up for these services. We're there to expedite it. If they want, we'll make it go super quick because we understand there's a shortage of dialysis, shortage of psychiatric services, and a shortage of primary care in many parts of the state. And we're all about trying to remedy those problems. We totally agree with you about that. We don't think we're in the way of any of that, but I mean, anytime that there's something that we can do to improve the services, believe me, we'll be attentive and listen. And we're trying our best to try to fill those gaps. But oftentimes it's just nobody stepping up with the funding to solve the problem.
Okay, any other questions? Okay, we're moving on. SB 2682, relating to lead poisoning. First up, we have, 2180, SB 2180, relating to chore services. First up, we have Department of Human Services providing comments.
Aloha,
DHS. Please.
Mahalo. Aloha Chair Sam Buenaventura and Chair Yoho Kalole and committee members, and Meredith Nichols, here on behalf of Kathy Betts, DHS, will stand on the written comments that we provided. Mahalo.
Okay, thank you very much. Next, we have Ian Seeley in support. Please
Hi there. Aloha. Navigating disabilities challenges, my wife and child face an unfair decision limiting their chore services. This highlights the current system's flaws. An outdated ranking system excludes many, excessive paperwork delays aid, and the limited scope leaves deserving individuals behind. Senate Bill 2180 expands access, streamlines processes, and creates local jobs. My further proposed edits simplify program recertification for regular providers and clarifies able household members to avoid misinterpretations. Cost concerns are addressed by exploring alternative funding sources and a sliding scale. Job creation stimulates the economy. Disability can touch anyone. So let's build a stronger safety net with Senate Bill 2180. Thank you.
Okay, thank you very much. Anybody else wishing to testify on SB 2180? Members, any questions? Seeing none, moving on. SB 2682 relating to lead poisoning. First up, Department of Health in support.
Department staff on its testimony and support and offer the amendments on your hearing.
Thank you very much. Next, we have just one other individual, Michael Older, in support. Anybody else wishing to testify on SB 2682? Okay, seeing none, moving on. But SB 2783 relating to Medicaid. First up, we have Director of Department of Human Services providing comments.
Aloha, mahalo chairs for having us on behalf of Director Betts and Meredith Nichols, and we will stand on the written comments provided. Mahalo.
Okay, next up, we have Hawaii Friends of Civil Rights in support. Okay, next we have Aloha Care in support.
Good afternoon, Chair, Vice Chair, stand on our written testimony.
Okay, thank you very much. Next, we have Hawaii Coalition for Immigrant Rights in support.
Aloha, Chair, Vice Chair, members of the committee, the Hawaii Coalition for Immigrant Rights stands for the
Thank you very much. Next, we have Hawaii Public Health Association and support. Next, we have Hawaii Medical Association and support. Next, we have Mental Health America of Hawaii and support. HCAN Speaks in support. ACOG, Hawaii ACOG in support. American Cancer Society Center Action Network in support. Legal Clinic in support. And 10 other individuals in support. Anybody else wishing to testify on HB 3125? SB 2783. Seeing none. Questions, members? Seeing none, moving on. Next up, we have SB 3125, relating to medical care for minors. First up, Department of Health and support.
Chairs, Vice Chairs, the Department of Health stands on its written testimony and support, and I'm here to answer any questions you may have.
Okay, thank you. Next, we have Oahu Youth Action Board, Partners in Care, Oahu Continuum of Care and support. Next, we have Hawaii Health and Harm Reduction and support, Heather Luss. Next, we have Stonewall, they're not present, Stonewall Caucus. No, that's Stonewall Caucus. Michael Kaloyo Jr., Stonewall Caucus, is Democratic Party of Hawaii and support. Please proceed.
Good afternoon, Michael Galoya Jr., Chair of the Stonewall Caucus of the Democratic Party of Hawaii. We stand in strong support of this bill. Funny thing is, under state law, you can get help if you from a service provider if you're 14 or over, if you get AIDS, but you can't get help to prevent getting AIDS. This bill will help fill that up, take care of that. We do encourage that anybody who's thinking about voting against this bill, that you go to and visit RISE and see the kids, the homeless unaccompanied minors that have been kicked out of their houses once it's been made quite aware that they are sexually active. So we definitely need, we cannot legislate good parenting, but we can legislate good health. And this is one way of doing that. So we encourage you to pass this bill to protect our youth. Mahalo.
Okay, thank you very much. Next, we have Rainbow Family 808 in support, Michael Galoya Sr. Next, we have Aiden Lee, Haumea Velasco, Opportunity Youth Action Hawaii in support. Next, we have Kekoa Kealoha in support. Please proceed.
Hi, aloha senators. Thank you for the chance to speak. I did submit written testimony. Thank you very much for reviewing that. The only thing that I wanted to add is that there's a lot of dialogue around these bills that mischaracterize it as usurping adult or parent supervision or involvement in children's healthcare decision-making. However, as somebody with nearly a decade of experience in providing counseling services and HIV testing to people who are at-risk youth, I can honestly tell you that the person who is not involved in the decision-making process more often than not, and who needs to be probably addressed are not necessarily predators, but who are partners of sexually active youth who are often not involved in the decision-making process at all. And this bill would greatly increase the access to additional tools to prevent the transmission of disease for people who are frankly capable of making that decision themselves. And honestly, if parents are involved in that decision-making process from the beginning, then this bill wouldn't have been necessary at all. Thank you.
Okay, thank you very much. Next, we have 9 other individuals in support: Danielle Sato, Kirsten Walker, Lisa Lee, Madeline Parasa, Thaddeus Pham, Jasper Bang, Chloe Stewart, Erin Fuyuchi, Nikki Ann Yee, all in support. And we have 3 individuals in opposition who are Mary Smart, Dara Yasushiro, and Sharon Martin. Anybody else wishing to testify on SB 3125? Seeing none, members, any questions? Seeing none, moving on. SB 3132, relating to medical cannabis. First up, we have Hawaii Department of Health in support.
Good afternoon, chairs, vice chairs. My name is Kyle Brandt with the Office of Medical Cannabis Control and Regulation. We stand in support with a written testimony, but I'm available for questions if you have any.
Thank you. Okay, next we have Clifton Otto, Akamai Cannabis Consulting, providing comments. Dr. Otto, please proceed. You have 1 minute. We have your testimony.
Good afternoon, chairs, vice chairs, members of the committees. Dr. Clifton Otto, Yes, you have my written testimony. I'd just like to add a few comments. This bill appears patient-friendly on the surface because it ends the sunset on primary caregivers, but it also prematurely limits grow sites to 5 patients and extends this limitation to caregivers, which is the wrong direction for our program to be heading, which is why I've proposed the amendments in my suggestions and in my testimony. I would also like to see this bill used as a vehicle for other changes to the program that patients are submitting, namely from SB 3278. And finally, this federal situation with cannabis in Hawaii, the Office of the Attorney General is saying that patients cannot have legal safe harbor. If this is true, then why are members of the Native American Church able to enjoy legal safe harbor from federal Schedule I for the ceremonial use of peyote? We really have not had a proper discussion of this issue, and I hope this is something we can do today. Aloha. I am available for any questions or discussion.
Thank you, Dr. Otto. Next, we have Adam 4342 in opposition, Anela Kealakai in opposition, 3 other individuals in support, Brian Cook in opposition, and 43 other individuals in opposition for SB 3132. Anybody else wishing to testify? Members, any questions? So I have a question, Department of Health. So most of these oppositions is basically the opposition of you folks decreasing the caregivers to 5 instead of what is existing, and decreasing the grow sites, the grow to 5 instead of the existing 10. Why are you decreasing it?
That provision has been in statute for several years. It's been delayed a few times, to my knowledge. Currently, there is not a limit, but yes, at the end of this year, there will be a 5-patient limit for an individual grow site.
So you're saying that you're not actually changing it, that it's actually already in the statute?
That's correct.
Doesn't look like it, but okay. But otherwise, you're not in opposition to keeping it currently instead of decreasing it?
We support the 5-patient limit. We believe, we believe in a kind of a community garden model and a small scale for patients to grow if they're not able to grow in their home for whatever reason. But we feel that large grow sites have issues with, turning into possibly commercial operations that are very difficult to regulate.
Okay.
There's issues with patient putting in legal jeopardy as well as patient safety.
Okay. Have you seen Dr. Otto's proposed amendments, which basically allows the limitation of 5 patients per caregiver, except for those areas that's zoned for agricultural use, and otherwise allow the department to regulate that pursuant to Chapter 91?
No, the department supports caregiving on a one-to-one basis. Expanding that, lowers the level of care that a patient receives from a caregiver.
Okay, thank you very much. Any other questions? Okay, seeing none, it's our last bill. So let's recess for decision making. Okay, thank you. Recalling the 1 p.m. joint HHS-CPN hearing for decision-making for SB 3123. Chair's recommendation is to pass with amendments. We're gonna accept the whole proposed amendments, which are to exempt renal services and psychiatric services, and otherwise also add in a technical non-substantive amendments. Any comments, questions, concerns? Seeing none, Vice Chair, for the vote for HHS, Chair votes aye.
Okay, Chair, this is Senate Bill 2123, correct?
Yes.
Okay, thank you very much. Chair votes aye. Vice Chair votes aye. Senator Keokolole? Aye. Senator Shimbukuro? is excused. Senator Owa.
No.
Recommendation is adopted, Chair.
CPN, same recommendation. Chair votes aye.
Thank you. Vice Chair also votes aye. Senator McKelvey. Senator Richards. No. Senator
Yeah.
Awa.
No.
Measure is adopted.
Thank you. For SB 2180 relating to chore services, Chair's recommendation is to pass with amendments. We're gonna delete section C on page 2, lines 7 to 16, and renumber the sections, and add a defective date of December 31, 2015 to continue further discussions. Any comments, questions, concerns? Seeing none, Vice Chair for the vote for SB 2180, pass with amendments.
Okay, thank you very much. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
CPN, same recommendation. Chair votes aye.
Thank you. Vice Chair also votes aye. Senators McKelvey and Richards are excused. Senator Awa.
Aye.
Thank you. Measures adopted.
Okay, thank you. For SB 2682 relating to lead poisoning, Chair's recommendation is to pass with amendments. We're gonna accept the Department of Health's proposed amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
CPN, same recommendation. Chair votes aye.
Thank you. Vice Chair also votes aye. Senators McKelvey and Richards are excused. Senator Awa.
Aye.
Thank you. Measures adopted.
So for SB 2783 relating to Medicaid, Chair's recommendation is to pass as is. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
CPN, same recommendation, passing unamended. Chair votes aye.
Thank you. Vice Chair also votes aye. Senators McKelvey and Richards are excused. Senator Awa.
Aye.
Thank you. Measures adopted.
So for SB 3125, Chair's recommendation is to pass only with tech amendments. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, 4 members are present. Any reservations? Any noes?
Noes. No.
Okay, no vote for Senator Awa. Recommendation is adopted.
CPN, same recommendation. Chair votes aye.
Thank you. Vice Chair votes aye. Senator McKelvey and Richards are excused. Senator Awa.
No.
Thank you. Measures adopted.
Okay, for SB 3132, Chair's recommendation is to pass with amendments. We're going to accept Akamai Cannabis's proposed amendments to allow for increased grow sites in agricultural areas within limits, and otherwise allow for other tech amendments. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, 4 members are present. Any reservations? Any noes?
No.
Okay, thank you very much. Recommendation is adopted.
CPN, same recommendation. Chair votes aye.
Thank you. Vice Chair also votes aye. Senators McKelvey and Richards are excused. Senator Awa.
No.
Thank you. Measures adopted.
Okay, we are done. So we are adjourned. Thank you very much. Adjourned.